Hello, everyone, and welcome to Front and Centered with me, your host, Patrice Charlotte, Communication Specialist for Equity and Community Health. We have got a great webinar in store for you all today, and I cannot wait to turn things over to our panelists in just a moment. But before I do, I want to remind you all that we encourage comments and questions, and we'll have a dedicated Q&A at the end of the presentation. To ask a question, please submit it by using the Q&A button located at the bottom of your window. Should you have any comments, please feel free to put those in the chat. Now, without further ado, I'd like to turn things over to Equity and Community Health Administrative Director, Natalie Johnson, to get us started. Natalie?
Thanks, Patrice. Good afternoon, everybody. My name is Natalie Johnson, and I am the Administrative Director for MG Equity and Community Health. For today's Front and Centered, we're talking about leveraging multicultural media to promote diversity in health education. Doctors Efren, Flores, and Gladys, Pachas.
Good afternoon.
So, as some ground, we take a step to March 2020 with the inception of COVID-19 pandemic, which illuminated disproportionate impact that the virus had on communities of color. Once data on infection rates by race and ethnicity began to be reported, we noticed trends highlighting the disparate burden that communities of color were carrying in the early days of the pandemic. For example, the map on the right displays neighborhoods within the city of Boston, in particular, East Boston, Dorchester, Mattapan, and Hyde Park, which are in the darker purple color, and are also home to more individuals of color. These neighborhoods have significantly higher rates of COVID in comparison to the rest of Boston. So with the inception of the pandemic, the fear and lack of information that came along with that, we launched the Community Health Task Force. COVID illuminated for a lack of trusted and accurate modalities and venues that individuals regularly seek for information. An example of trying to address that is this video clip here of Big Papi speaking in Spanish about staying safe during the early days. By fall 2020, with the need to address pressing social concerns and understanding needs in our neighborhoods, MGA embarked on the local implementation of Mass General Brigham's United Against Racism plan, which we called the Structural Equity 10-Point Plan. Over the next year, we worked on implementing initiatives related to the As part of the plan, and due to our community engagement over the past year and extending past the last year, we identified the need to have medically trained individuals on hand to be able to provide credible health information, dispel myths, and have a regular presence in the community. And you can see the bands here are often ways that we were present in the community. So our medical liaisons officially came on board in the fall of 2021 and hit the ground running. Medical liaisons have had to strengthen relationships and foster new relationships with multicultural media partners. In particular, they've strengthened relationships with multicultural and multilingual media outlets, many of which you'll see their logos listed below. Given what we've learned in the early months of the pandemic about fair misinformation and access to valid information, it reinforced the importance of meeting individuals where they are and when they need us. So, who are these medical liaisons that we've been talking about? We currently have liaisons. We have Dr. Claude Alabre, who is unfortunately unable to join us today, but he speaks English and Haitian Creole and has been focused on serving the Black and Caribbean populations in Boston, specifically in the urban core of Mattapan, Dorchester, and Roxbury. And then we have Drs. Efren, Flores, and Gladys Pachas, who are both here today, who are able to speak in English and Spanish to our Latino population in the Boston North communities of Chelsea, Revere, and East Boston. And their aim is to address community needs and expand our reach, MGH's reach in the community, discuss topics of interest on a number of platforms, serve as liaisons between medical experts at MGH and the community as a way to build trust through genuine partnerships. And lastly, leverage the respect and trust that media partners already have in these communities to demonstrate that we are credible sources for health. So they hit the ground running, haven't stopped, can't and won't stop. So Dr. Pachas, can you tell us more about what you've been doing?
Thanks, Natalie. As you said, what we're doing as medical liaisons is really to strengthen existing partnerships, but also developing new ones with the community and community organizations, specifically multicultural media platforms, with the goal to really promote dissemination of health information that is based on scientific evidence, effective, accessible, and delivered in a timely manner, and also importantly based on community needs. For example, we have been working with Boston-based Spanish language newspapers and TV stations that serve the Latinx community. We have, for example, El Mundo, which is one of the largest Spanish language newspapers in New England. They have this segment called La Hora del Café, which is coffee time. It's a popular live stream program. We've been presenting topics, not only about COVID, but also other topics that the community wanted to hear about. Topics like blood donation, boosters and vaccination, mental health, children's health, migraine, headache, chronic back pain, different specific topics that we here in the community want to learn more about. We also have been working with Java with Jimmy, which is a platform that really started in response to COVID-19, and it has become a community, really a place where for people to engage in discussions about different issues, and we also are presenting different topics with Llama with Jimmy. We also been working with other newspapers like Planeta. We've been very active during COVID in terms of testing, how to test, vaccination, importance of vaccination, and other topics. We also been working with Univision, which is a television station in Massachusetts, really working with Latinx community and also presenting different topics with them. We also have been working, organizing or participating in different community events. If you can go to the next one, Natalie. So we have community events that, for example, in Chelsea Day, we went there, participated. Can you go to the next one, Natalie? Awesome, thank you. So you can see here, there are different events that happen all over Boston, and we've been really participating in a very active way, going there, talking with people one-on-one. You have a question, please tell us, what do we want to discuss? What do you want to learn from us? We've really been trying to immerse ourselves in the community and talk about the thing that they want to hear from us. I've been working very close to with another group from MGH, which is also the Community Messengers, which is a multilingual, multicultural group that is also participating very actively in the community to provide clinical expertise and discuss health information with community members. In short, what we've been doing is really using a multilingual, multicultural approach with accessible options. We've been going into the community, not just waiting for community to come to us, tailored to community engagement and using some of the non-traditional means of information to share really health information into the community. Because we are convinced that it is important to empower our communities, give them the tools to make their own health decisions based on scientific evidence, not on fear of misinformation.
Thanks, Gladys. So given the work that you both have done over the last 2 years, what would you say are your 3 key takeaways?
I can take the first part, Efren.
Go ahead, Gladys, go ahead.
I think one of the main things that I learned is how amazing the MGH community is. We've been, for you to present into any of those media platforms, we need clinicians that are able and willing to really discuss this with the community many times in live sessions, Facebook Live. And, you know, it's amazing how I reach to different clinicians and they just waiting for me to say the word, just let me know, when do you need me by, and I'll be there helping. And it is really how the community at MGH works. It's we're willing to, you know, to go there, do the work. And I thought that was amazing.
You know, along those lines, Gladys, I would say, you know, a couple of things. You know, one of them would be definitely the sense of pride that the MGH community has in their work and providing excellence every day. So I know that that's something that is what we talk about in the clinical care, but not only people are ready to step up, but everyone at the institutional level is really committed to do what is best for each patient that they're seeing or when they are in the community or any setting. So we're not only ready to we deploy or do the work, but also to provide the best care possible. And that's what does our North Star, what drives our care, what drives us that excellence, and that also doing what is best for our patients and the community. And then the other thing I would say during this time is that credibility and trust are built with time, right? Time and effort. So it's just not something that is built overnight. It really takes a commitment. It really takes a sense of forming true partnerships with our community. So our approach can be prescriptive. We can't come in and just say we're going to do this. We have to come in and into a table to come together, discuss ideas, share ideas, and truly form partnerships that are formed around trust. And that takes time. That takes a continuous presence in the community. It's not about executing one goal or we're going to do one event. It's just really when the community needs understanding what are the community needs, being there, like Natalie mentioned, not only meeting the patients and community where they are, but when they need it, when there's an opportunity for us to help them. And it may just be within a specific project, or maybe something that the community has a specific need, and we are always there. And then that's what takes, I always think about trust and credibility, similar to watering a plant. It's not something that we're going to do now. It takes a commitment to watering that plant now and in the future, and it's an ongoing process. So why we're focused on forming the longitudinal partnerships is to have a strong foundation, to build those bridges of trust, to connect with the community. Then we can not only improve the pressing issue right now, which may be COVID or upcoming vaccination with flu, but also what is, for example, like what is coming next? How else we can be of service to the community? And that's something that I would say is critical. So our agenda is co-develop and in collaboration, in part through partnership with the community, because our patients and our community are what drives our care. I think that speaks to the.
So can you tell us a little bit more about your next steps, Efren? Yep.
So that speaks a little bit about you know, that longitudinal engagement is what this next slide talks a little bit about what is next, what is coming next. So not only we've been able to establish some current relationship with social media and conventional media outlets, Gladys was mentioned. So we're also planning to expand those collaboration with community partnerships. So for example, MGH has an established presence in Chelsea through the health center, and now we have developed a strong collaboration with La Colaborativa in Chelsea. So now La Colaborativa will be expanding their efforts then into a new site. Then we are already in discussions about how we're going to successfully expand that partnership so we can collaborate with them into what they will be offering. So for example, not only on-site presence, but for example, cooking demo with their new healthy kitchen that they're developing, as well as having pop-up fairs and presence in those fairs like what we had last year, as Gladys mentioned, in the Chelsea Day, and on ongoing events as well. And it really, we don't come with a already pre-made agenda. We may have an idea of what are pressing issues, and so but finding a common ground into what is happening in healthcare, but also understanding what are pressing issues in the community. So for example, in October, we have Breast Cancer Awareness Month, and how do we connect that from the healthcare setting to an ongoing initiative in the community so we can be more effective, right? So, and that's where the partnership comes. We have an idea and then collaborate with organizations such as La Colaborativa, MBA Chelsea, and see what are most effective channels, what are some of the events happening in the community that we can tag along and use as a vehicle to not only have that longitudinal presence, but also drive the message that what we're all achieving together is healthier communities. So if I go, and the other thing, so these are, this image here has a couple of, like, for example, Gladys doing some of the El Planeta events. We have Natalie and myself with like La Bodega, Bodega Makeover event here together, but also the implications of the work not only impact us locally, but also have national implications. So what we're doing here at the MGH level has helped, for example, me in Lessons Learned to participate in a national committee with CMS's National Academy of Medicine and World Health Organization, where we're evaluating, identifying credible sources of health information in social media. So the implications of the work, the infrastructure that we're developing here have not only local and institutional level implication, but also have implications at the national level. So if we move on to the next slide. So wanted to also say, like, if you're interested, to the audience here that is with us today, that none of this would be possible without the helping hands of many, right? So we talk about the health disparity and delivering equity, and sometimes it may seem like a heavy lift, but a heavy lift with many hands becomes lighter, right? So coming together, I see some names on the attendee list. I see Dr. Betancourt, Joe, I see Sylvester, I see many names that made it possible, right? So we're missing, I say Claude here, but but definitely been an incredible partner, Natalie as well, Patrice, Gladys, and everybody. So for the audience that is listening here and that will be listening at a different time, you can definitely catch us through Java with Jimmy, what happens the first and third Tuesday of each month, and that hosted with co-hosted by Claude in collaboration with Jimmy. And then also every other week we have El Minuto de Salud, which will be like a quick health minute at El Mundo Boston, this online show that happens the second and fourth Wednesday of each month. And the purpose of this is to have that continuous presence, to have that collaboration of through this multilingual social media presence. We will continue enhancing this message of overall health in the community, and then also continue building trust and credibility through our audience. And then I think, do we have
Yeah, thank you, Efren and Gladys, for sharing all of that with us. I mean, for me, I think the sense of pride in one's community and knowing that we have a willing cadre of physicians who are, and even non-physicians, who are at the ready to support the community and ready to support patients and staff really stood out to me. And since fall 2021 alone, our medical liaisons and other physicians have conducted over 40 Facebook Live or video segments. So that's very impressive. That's almost a video a week. And just speaks to the dedication of the work. And so this quote here, I feel, encapsulates the message that we shared with you today and the work that we've been doing, that interventions are most successful when they target individuals or communities, address known barriers to screening, deliver tailored messages, use multiple methods of message delivery, and are delivered over multiple periods of time. So I leave those words with you as I turn it back over to Patrice. Thank you everybody for joining today.
Yes, yes. Thank you, Natalie. And thank you, everybody who's been in attendance. And thank you, Efren and Gladys, for such an incredible presentation and discussion. So now I want to transition us over to our Q&A. We did receive a question, and so we're going to transition into answering that now. And as we do, if anybody has any additional questions, feel free to put those in the Q&A by pressing the button on the end of your screen, the bottom of your screen. So we did receive a question from a physical therapist with a specialty in pelvic health. And this physician, or this physical therapist rather, is sharing with us some of the challenges that they're facing in their work, including not having content in multicultural and different languages. So the question that we have for our panelists today is, what is the best way to find out how a certain patient population is getting their information? And beyond that, how can educational outreach for special topics like this have the greatest impact? Does anybody want to chime in?
I could try to start. I think one of the best ways, according to my experience, is as going into community, not just staying in your hospital or clinic, going there and do focus group, like talk with people, right? You can either talk one by one, or you can organize, talk with some of the community members and organize focus groups with whether you want to discuss it with older population, younger population, depends on what you need, but like have a group of people you can go there, talk to, ask them questions directly, introducing yourself, why you want to do this, because you really want to learn from what they want, you want to hear their voice and go from there, right? Really, people are so willing to talk, to tell us what they need, to really help us help them, right? Help each other, I think. They really wanted to talk. I think one of the first steps I would take is having focus groups and conversations, like going to community events and talk with people and say, hey, I'm planning on doing, I work at the clinic, I'm planning on doing this. What do you think? Do you think that's important for you? I think that would be my first step.
I'd like to add to that a little bit. Just there are two parts of the process. One, identifying what are the pressing issues, and to Gladys' point, you can certainly do it through focus group discussion. And certainly, like for example, like when they post a question, that's an very valid point, and something that when I think about things, I think about listening with intention, right? So understanding that there's a valid point. There are many that may have similar questions in the group. So identifying not only what are some of the pressing issues from your patient, but also when you're going into the community, you're listening with an open mind. There's no right or wrong answer. There's perception is reality for many. So even if we think that there's like information that is misinformation or disinformation, that's what is getting to the community. So understanding that perspective will provide us with key information to better address it, because the main issue is like when this information is not, when there's a lag in multilingual information, this gap of knowledge gets filled, unfortunately, by misinformation or disinformation. So when it takes a more proactive approach for us to say, okay, once we're gonna develop new information, for example, let's say in this case for physical therapy or incontinence postpartum instruction, not only we're gonna update the information, but we're going to offer in multiple languages as soon as we develop it and deploy it. And that process is being actively changed, and we're revamping that process at the institutional level. So I'll talk about work in radiology. So right now we recently sent out prep information for CT, patient undergoing CT. So now we have the multilingual prep information for that imaging modality that we're just sent out and revamped. But also, don't feel that you're alone in this process, because that's the sense of community here is very strong. there are others that may have similar interests. And when I said about many hands can help do the heavy lifting because it makes it lighter, I firmly believe in that. There's a lot of people, a lot of dedicated people in the community that make all of the process that we're presenting today possible, but also that are interested in doing more. So there's always a question, how do I get involved? And it could be from updating from the postpartum instructions or physical therapy for some patients. For us, and that may be in the OB or physical therapy scenario. For me in radiology, it could be about prepping for patients, or for example, like Gladys and her work, or like and others. So leveraging the existing resources and the framework that we have, so we can achieve more, because together we can do so much more, and that's really key. There's no point of reinventing the wheel. We can work together, find your community, which is here. Work together so we can not only accomplish that specific goal, but also think about new idea and more way that we can expand and achieve much more. And I think that's something that is very unique of this institution, in that sense of collaboration and community that is very strong here.
And please feel free to reach out to us. Maybe we can help, right? Maybe we can go work together. We, during this time, we've been learning so much and getting to know a lot of people that we can actually help.
Awesome. Thank you, Gladys. Thank you, Efren. So in your responses, you two were talking a lot about collaboration, amplifying voices from the community. What advice would you give for someone who wanted to get a focus group started? How would somebody begin that process?
Contact us. Because like I said, I've been talking with people in Revere and Chelsea and learning how to actually organize focus groups. Because of my work, I'm actually doing it. It is important really to find your champion in the community, right? To find your person who's going to be able to, you need to talk with A, B, or C, right? And then maybe you are going to come at 6 p.m. or 8 p.m. instead of in the morning. So it's really important to pinpoint a person who knows the community, one, who's willing to work with you, and everything's going to be much easier that way. Otherwise, it can take your time. So again, like Efren said, take advantage of the things that we've been doing, the people we've been getting to know, and we can help each other organize all this.
Thank you, Gladys. Efren, did you want to add something?
No, I wanted to say, like, I agree. I think that connecting with, for example, Natalie and others at the MGH Equity Office team, for example, like you can talk about Winnie from the Center for Community Health Improvement and others, right? So people that already have like long-standing longitudinal presence in the community, and we're always open and happy to help as well. And also what I would say to people is, like, really try to get a feel for the community, right? So can't be transactional, right? So it's not like, okay, I want to do a specific project, I want to do a focal group. It's just like, I think that a great starting point is always to go spend some time in the community, see what it feels like, right? So what it feels to you. So whether I usually when I'll go to a barber shop, I'll get a haircut myself, or I'll just go eat food there, get some grocery, Latino grocery, for example, at the place, and that allow just to informally just get a feel, right? And before I do anything, and in that process, you're gonna listen to informal conversations about what are some of the pressing issues, and that actually can inform your process, but also not that you're going to like immediately get drunk, but it gets you a better sense of what how to best approach the community, but also what is needed, and that will change your perspective. So I encourage everybody just to, like, before they get involved, actually just to spend some time in the community to form that connection before engaging in specific work. I don't know, Natalie, if you have any additional.
No, I think you guys captured it. I think the only thing that I would add is identifying the key stakeholders for the specific area that you're working on. But Gladys kind of touched on that, but I think you guys got it all.
Awesome. And I would agree. Thank you to our panelists this afternoon, Natalie, Gladys, and Efren, for such an incredible presentation. I've learned so much today, and I hope that you all have too. So we have reached the end of our time together, and I would encourage you all to remain connected with our panelists by the contact information that you'll soon see on your screen. So that does conclude this month's Front and Centered. Thank you, thank you, thank you to everybody for attending. We do hope to see you at our next Front and Centered, which will be happening on September 29th, also at noon to 12:30, where we'll be discussing access to care from doorstep to bedside with members of the Disparities Solution Center. Thank you so much, everyone. We hope that you have a great afternoon. Take care.
Thank you, everyone.
Thank you.
Thank you.